We're seeing so many people fall through the cracks and getting too sick before they get the care that they need.
If you're wondering why you are getting sick again and over a longer period of time, then you're not alone. Recent data from the Alberta government's respiratory dashboard shows a surge in RSV, influenza, and COVID numbers like never before. Pediatrician Dr. Tehseen Lada says the primary reason for these continued illnesses is the combination of low immunizations, a change in weather, and infections.
We're seeing adults and children having multiple viral infections at once. And because COVID is so transmissible, people are getting COVID and then they're getting RSV, or they're getting COVID and they're getting influenza. And when they're having two viruses at once, they're of course getting more ill than they would with one virus, and they're staying ill for a longer period of time.
The respiratory dashboard shows the total numbers for this season: more than 10,000 influenza infections with 80 deaths, almost 13,000 Albertans infected with COVID and 378 deaths, and for RSV, 2,205 infections so far this season with no data on deaths. Pharmacist Brian Jones says prescriptions for antibiotics is as high as it has ever been, agreeing with Dr. Tehseen Lada that though it doesn't seem to be a priority for Alberta families, getting the COVID, influenza and RSV vaccinations is an important step to avoid getting sick repeatedly.
We're seeing a lot more antibiotics this year. Ask any pharmacist, any pharmacy team. I work in a small pharmacy right down in South Calgary, and every day people are in the pharmacy are like, I can't believe the amount of prescriptions for antibiotics that we're doing, or the number of phone calls that we're getting. What do I do? Strep throat tests are even picking up as well, right? So all kinds of potentially infectious diseases are coming through the pharmacy at a much higher rate than previous years.
Dr. Lara says this increase in illnesses is overburdening the healthcare system, which is already working at overcapacity, and is calling for everyone to step up in tackling the health crisis.
We seem to have failed to implement some of the basic learnings of the pandemic. Even just implementing things like improving indoor air quality, using HEPAs in classrooms, implementing masks voluntarily in a high respiratory peak season in crowded indoor spaces.
In Calgary, Henna Saeed, City News.